Do you want to know more about how you can eat for better health and longevity, and how your diet and lifestyle can play a part in chronic disease? Then you're in the right place. I'm Claire Day.
And I'm Daisy Lund, and we are both plant-based doctors with a passion for improving nutritional education. In this podcast, we will bring you all the latest medical evidence on how a plant-based diet can improve your health whilst being kinder to the planet and fairer to the animals that we share it with.
Twice a month, we bring you interviews from experts in the field with a focus on an important topic related to plant-based health, all while sharing recipes and food ideas.
So, welcome to, in a nutshell, the Plant-Based Health Professionals podcast.
Welcome everybody to Season 3. Well, we are back in the nutshell after what seems like a long break for Season 3, but we haven't been idle, have we? Or have we a bit, Daisy? Did you enjoy the break?
Hi Claire. Yeah, nice break, thanks. But I'm really glad to be back, actually. A month off the podcast has seemed like a long time, and it's made me realise that this is one of the most enjoyable parts of my week. So I'm buzzing for the new season ahead. And what a great way to start the new season. This week, we've got Dr. Carlijn Wagenaar, who is a medical doctor and a researcher based in the Netherlands. And she came on to tell us all about a randomised controlled trial that she's been working on called Plants for Joints.
Yes. So we have been busy and there's been a lot happening on the plant-based front, which means we've got a stack of great episodes, not just today's, lined up.
Absolutely. But before we start, is there anything you'd like to highlight from the plant-based evidence base?
Yes. How about the Food Foundation report, Rethinking Plant-Based Meat Alternatives, which came out earlier this week? Did you get a chance to look at it yet?
Yeah, I did. I read it and I watched Rebecca Toby actually deliver a summary of it on the Plant-Based Health Professionals webinar.
Of course, and I'm sorry to say that I missed that webinar. Hopefully I'll catch up on it, but shall we summarise the report here? Because like all Food Foundation reports, their most notable ones being their annual broken plate reports, it's really readable and it's got great graphics. And if you don't want to drill down to the detail, there's a great executive summary with the key messages.
This is a report which talks about the importance of eating less meat, but applying some scrutiny to what the options are for plant-based meat alternatives. And it actually proposes putting them into 3 categories. They divided it into processed new generation versus processed traditional and less processed like beans and grains. And they analysed the environmental and nutritional aspects of over 100 products.
So from that, what was the overall message?
Well, no surprise, the conclusion is that we need to eat more beans, as we always say on the podcast. But it also makes the point that all 3 categories are in fact lower in saturated fat, have fewer calories and more fibre than their meat counterparts.
So I think our hope is that it will go some way to influence policymakers and particularly those procuring food for places like schools, hospitals and prisons.
Yeah, absolutely. And it also provides some great facts for healthcare professionals too. So, when you're met with the statement of, oh, isn't vegan food bad because it's processed? Well, actually, not the case.
Yeah, what the report's doing is it's confirming that there's a lot of nuance between the idea of plant-based food being processed, and it's going to unpack some of the differences in the nutritional value there.
Yeah, it's a brilliant report and we'll link it in the show notes.
But we should introduce today's interview, shouldn't we? As you've said, we were joined by Carlijn Wagenaar, who is a researcher in the Netherlands, who talked to us about Plant for Joints. And it's an intervention for people suffering from rheumatoid and or osteoarthritis, which focuses on the use of a whole food plant-based diet, physical activity, and sleep and stress management. It was a randomised controlled trial, bringing together some great evidence for benefits to patients. And it would be my dream to see programmes based on something like this available through the NHS. What did you think, Daisy?
Yeah, absolutely. But until they are, it's great that the evidence is coming together so people can at least inform themselves of what lifestyle measures to prioritise to manage their own illness.
That's exactly it. Don't wait for the NHS to make you better. There's no waiting list for making your own lifestyle changes. Let's listen to the wisdom of Dr. Wagenaar now.
So hello and welcome, Carlijn. We're incredibly excited to welcome you as the first guest of season 3. And what a way to start the season. I've been particularly looking forward to chatting with you for a number of reasons, both personally and professionally. I heard you presenting your research at the VegMed conference last year, and I was interested, given I've got quite a strong family history of bone and joint problems that run in the family, but also given my day-to-day clinical practice as a GP, I see probably at least one patient every day with arthritis. And, quite often people are living with very painful chronic conditions like arthritis, and they don't get that much lifestyle advice, or they've been told perhaps to lose weight, and that's about it. And quite often these patients can feel very helpless and very disempowered. And this leads on to a cycle of relying on stronger and stronger pain relief to sort of get them through the day. So when I came across plants for joints, it was like a revelation, and I can't wait to talk to you more about it. So thank you for coming on the podcast. For listeners who haven't come across plants for joints yet, can we start right from the beginning? Before you tell us more about your research, can we start on your personal background and how you came to be involved in research science?
Yes, of course. Well, thank you so much for having me. So I'm Carlijn. I'm a medical doctor in the Netherlands, and I actually grew up in the United States. And I grew up in a very active family. So my dad was also a researcher. He studied the effect of movement on Parkinson. And I grew up in a family where movement, but also food was quite important. So that kind of laid the basis for where I am today. And over time, I discovered, partly because I was very active doing athletics, I wanted to know more about how the body works, but also how do you reach those best times? How do you run fast? How do you nurture your body? Due to that interest, that's also the reason I started studying medicine. So I started my medical study, and that was also the first moment I actually had to cook for myself. And I did not know what to do. I had never really cooked at home, but I had a basis of what healthy food was, but I just didn't really have a great understanding. So one of the first things I reached for was a book I received from one of my athletics coaches when I was still living in the United States, because when I was 16, I had come to the Netherlands. So at this point, I was already here. Really, it was just, clean eating. So broccoli, chicken, rice. It was very basic. And I was interested, so I started learning a lot more about it, reading a lot more sources online, and genuinely, I was just really confused. Certain magazines said eggs were like the ultimate health food. Others said you really have to be careful. Bread, is milk healthy? No, yes or no? I just had no idea at this point, and I really wanted to know. So for me, that was really an inflection point where I started doing a lot of my own research. And one of the first things I came across was the What the Health documentary on Netflix. And this was another one of those things that I was like, oh God, now I can't eat any animal products. So that for me, that wasn't a reason to make the switch right away, but it did, keep me interested. And over time, I started reading more about it. And that's also when I came across the How Not to Die book by Michael Greger. I read that. I was at training camp with all my athletes in Portugal. And the moment I came home, I decided that I was just going to eat 100% whole food plant-based diet. And that was about 8 years ago. Yeah, that kind of changed my whole life, because at that point I was already in my medical education, and I was learning all these things, not only relevant for myself, but also relevant for all the patients around us. And so for me, that really became my mission to encourage people to focus more on lifestyle, especially nutrition. I was in the beginning of my medical career, so it was a struggle, let's say, to get through it, because there really just wasn't any attention for it. So for me, it was really kind of figuring out where do I fit, shadowing doctors that I found inspiring, doing research projects and projects that kind of aligned with my views. And slowly but surely, that's how I also came across the professor that I work with today. And that's why today I'm doing my PhD in Amsterdam with the Plants for Joints team.
Fantastic. I mean, what a story. It'd be really interesting to talk to you more about your experience of going into medicine and already having that knowledge about plant-based eating. But the main topic we're going to start with today is to talk about that research trial, the randomised controlled trial, which was assessing lifestyle interventions for people with osteoarthritis and rheumatoid arthritis. Before we go into that, could you perhaps give us an outline of what the differences are between those types of arthritis? Because people will often mix them up if they're lay people, and why it was then interesting to study both if they're so different.
Yeah, so in our study, we looked at two types of arthritis. We looked at rheumatoid arthritis and osteoarthritis. Rheumatoid arthritis is an autoimmune disease, which means that people actually their immune system reacts to their own body. So they get stiffness, swelling of joints, and also over time, this can damage the joints. So it's an inflammatory disorder, as we would call it. Then the other is osteoarthritis. Now, osteoarthritis is actually a lot bigger group of people. For example, rheumatoid arthritis, it's about 1% of the Western population. Osteoarthritis can be up to maybe even 10%. So in the Netherlands, it's about 10% of the population. And osteoarthritis is really a change in the cartilage of the joints. So a lot of times it's associated with aging, and it's not as outspoken inflammatory as, for example, rheumatoid arthritis, but patients do suffer from pain, stiffness, and their physical function can be limited. And also we know that there is, for example, a little bit of low-grade chronic inflammation that also plays a role here, but this inflammatory component is not as strong as with rheumatoid arthritis.
The inflammatory component that is there in osteoarthritis, do we know anything about where that comes from?
Well, the thought is that, for example, metabolic syndrome plays a role. So when we talk about metabolic syndrome, this is a composite of risk factors: high cholesterol, high blood sugars, and also visceral adipose tissue. So really the fatty tissue around the organs, which is also why the waist circumference is increased with people that's one of the risk factors in people with metabolic syndrome. And we know that this visceral adipose tissue, for example, this is pro-inflammatory. So this can help create this low-grade inflammation within the body, which is then also thought to play a role and impact the cartilage that we see in osteoarthritis.
Thank you for clarifying the sort of similarities, I guess, or the differences between the two. Can we head straight into what you did in your research? So what was the original aim of Plants for Joints?
There are a lot of studies that have looked at, well, not a lot, but there are studies that have looked at nutrition and lifestyle within these two diseases. So if we started, for example, rheumatoid arthritis, in the early 90s, some beautiful studies were published, for example, in Sweden and Norway, looking at, first of all, a study that did 7-day fast, followed by a 3-month vegan, and then that extended to a vegetarian diet for a whole year. And what they found in that study is in people with rheumatoid arthritis, the inflammation, the amount of swollen joints, the amount of tender joints, and those are all markers we currently use today also to evaluate the disease activity of these people. All of those were significantly lower than the control group, which received standard care. And in other studies, for example, also using a Mediterranean diet, they found similar effects. So there was already some indication that fasting, but also plant-based diets could be of benefit for these participants. Furthermore, we know that stress plays a really big role. So when we look at people with PTSD, we also know that those have a 2 times increased risk of actually getting rheumatoid arthritis. So stress seems to play a role, and also interventions that help with stress management also seem to have some benefit for these participants as well. And then when we look at exercise, we also know that, for example, in a study looking at women that were more moderately active compared to those that were more sedentary, their risk of getting rheumatoid arthritis was also lower. Muscle and strengthening exercise is also very important for people with rheumatoid arthritis. So keeping all of that in mind, we had some indication, hey, these lifestyle factors seem to be of benefit for these participants with rheumatoid arthritis. Then when we look at osteoarthritis, there's less studies, and a lot of studies looking at lifestyle and osteoarthritis, they're really focused on weight loss and mainly calorie restriction, as well as, for example, also muscle strengthening exercises. So there's a beautiful study that looked at, a calorie restrictive diet in one arm. In another group, they looked at these muscle strengthening exercises. And in a third group, they actually looked at the combination of both. And they found that each of those individual factors had effect on these people with osteoarthritis, but actually combining those factors together had an even stronger effect. So now we knew, okay, there's some potential effect in rheumatoid arthritis of the individual factors. We don't know actually what happens when you combine these factors. In osteoarthritis, we see that combining these lifestyle factors seems to be of an even greater benefit. And then there's also other studies, and one that we really found inspirational was from Dean Ornish in the United States. And he looked at a whole food plant-based diet in combination with exercise, stress management, and sleep training, all in a group setting in people with cardiovascular disease. And what he found is that after 5 years, that There was even a slight reduction in the narrowing of the coronary arteries, which is actually an indication of the severity of this cardiovascular disease as compared to the control group, which received standard care. And why this is actually relevant is, well, first of all, people with rheumatoid arthritis and osteoarthritis have a 2 times increased risk of getting cardiovascular disease, but also a lot of the underlying mechanisms at play in all these chronic diseases, so this low-grade chronic inflammation, is the same. So that's why we decided, okay, we're going to create an intervention that combines all these lifestyle factors, so a whole food plant-based diet, exercise, stress management, and sleep in a group setting, and we're going to test if that's effective in people with rheumatoid arthritis as well as people with osteoarthritis. That's the basis of why we created this study. And I'm saying we, but actually my professor Dirk-Jan van Schaardenburg, as well as a dietitian, he's a rheumatologist, as well as a dietitian, Wendy Ravenstein, they were the geniuses behind creating this program. And I was very thankful and lucky to join in as well.
That's fascinating. And before we go to any results or outcomes, tell us a little bit about the actual intervention. So can we go into these areas and what you actually did, what the study design looked like?
Yeah, so our intervention, this was the intensive period of our study, was 4 months. So we had a group of people with rheumatoid arthritis. We had 77 participants, and we had 64 people with osteoarthritis. Participants were randomized. So randomly, when participants completed actually followed our inclusion criteria, they were either put in the intervention group or a control group, which received standard care. Now, those that were put into the intervention group, they received a 4-month intervention consisting of a whole food plant-based diet, stress management, sleep, and exercise. What this consisted of was 10 group sessions. The first one was a cooking workshop. And this was really one of the most important sessions because people actually learned how to make these meals. It's really not that hard. They learned how to taste it. It actually is really yummy. And also they met their group members. And that's really important that they saw each other face to face and also created a bond together. After this cooking workshop, the group sessions varied from topics. Sometimes it was about nutrition. Sometimes it was about exercise. We did a lot of mindfulness training with them. They also received a movement test. And in this movement test, we asked participants to actually predict how many exercises, how many repetitions of certain exercises they were able to do. Then they actually performed this test. And afterwards, they reflected on it. And some people noticed, oh, I was actually able to do a lot more. So we see that a lot with people with osteoarthritis. They're a bit hesitant to move. But actually, well, first of all, it's great for them, but a lot of times you can do a lot more than you think. But in other people, we noticed they really crossed their boundaries. So they had a lot of pain and they wanted to do it a lot better than maybe they were actually able to physically at that moment. And that seemed to be kind of characteristic of our rheumatoid arthritis group. So this process not only helped them learn about movement, but it also really helped them identify their physical barriers and also kind of get a starting point where they are now and where they want to come to in the future. So when we look at the exercise component, we use the WHO guidelines, which are also the Dutch guidelines. So we encourage participants to do 150 minutes of moderate intensive activity per week, as well as 2 times a week of stress or muscle strengthening exercises. And the whole food component, whole food plant-based component of our intervention was really the dietary guidelines we have in the Netherlands, but we made it a plant-based version of that. So it was a very complete dietary intervention.
The dietary intervention is always the really difficult one, isn't it? Because people are going back into their homes with their families. How did you design the study to sort of look at adherence of those measures?
One of the things we did was we invited participants, their partners, to take part in the cooking workshop. This was not always possible, especially with COVID, but that social environment is really important. So that's something that relates to adherence, but we also measured this in our participants. So we had participants fill in food diaries at the start, halfway, and end of the intervention, as well as in our follow-up study. And we asked them how many minutes per week they did physical activity exercises, as well as stress relieving exercises. So using those outcomes, we were really able to see, are they eating plant-based, to what extent, as well as using those data, we could create a composite score, which kind of gave us an indication of, that adheres to the whole program.
Were any of them plant-based to begin with, or did they have to completely overhaul their diets?
One of the exclusion criteria was that they were already plant-based. So we did have some vegetarians, but no, they really needed to be able to make a big dietary shift. Otherwise, we probably wouldn't be able to see that much change.
And as Claire said, that's probably one of the biggest challenges, I'm assuming, for people. How was the adherence? Did you find people did stick to that?
People did a great job. They really did a fantastic job. By motivating each other in a group, it helped them stay motivated. But over time, if they experienced effect, this really stimulated them to keep doing it. And we also heard a lot of anecdotal stories from participants saying, for example, I was out with my friends last weekend and I had a lot of meaty snacks. So in the Netherlands, we have something called bitterballen, which is essentially a fried ball of meat gravy. They have good vegan versions as well. But she had a whole plate of those. And then all of a sudden, the next day, she had a lot of swollen and painful joints. And we heard this more often. We also learned this was kind of a negative feedback loop for people themselves. Hey, this really does have effect on my body. And I think that's really unique about this patient population. For example, if you would do a trial like this in people with diabetes, they might not feel the physical effects of an intervention like this. But in our population, they actually had pain. So they really had this feedback loop. And we do really think that this played a really strong role in the good adherence that we had, not only throughout the first 4 months, but actually up to 2 years after the program.
That's so interesting. Shall we drill down a little bit on the stress management aspect before we ask you about results and outcomes?
Yeah, so our stress management aspect was based on earlier studies looking at mindfulness training, for example. And the stress portion of the study was a bit more individualized. So we really first of all, we gave people information about why stress can potentially be harmful and what causes stress, and also that you can have influence on it. So that was the theoretical part of it. But then we also let people explore themselves. What are the things that relieve your stress? So it's not that people had to meditate 10 minutes a day. It would have been great. But for some people, meditation doesn't work. Some people really found a lot of benefit of going for a walk in the forest, for example. So how we implemented this really depended on the person themselves. But most of all, we gave them that basis of why it's really important to work on this and to try, where possible, to implement this.
It's so exciting to hear that people were getting feedback almost, in some cases instantly from some of the changes they were making. So where they ate a meaty food or a cheesy food the next day. So we're really excited to hear if that could happen in the short term. What results did you actually see after 4 months and then maybe even in a year following up from the study?
So we did measurements at the beginning, halfway, and end of this 4-month period. And we also followed up people 2 years after the program, where we did measurements every 6 months. So when we look at the first 4 months, we had as our primary outcomes, so these are the main outcomes of the study. For the rheumatoid arthritis group, we looked at disease activity. And for this, we used a score, and this we call the disease activity of 28 joints, or the DUS score. And this score is based on 4 components. So we have the erythrocyte sedimentation rate, which is an inflammation marker in the blood. We have the amount of tender joints. We have the amount of swollen joints, both of which were assessed by an independent research nurse. And we had a score that the participant gave themselves from 1 to 10. How do I feel as a result of my joint complaints? This score at the beginning was about 3.9 for our participants. And we wanted them, they actually had to have a score in the range from about, let's say, 2.6 to 5.1, because that indicates that they have a moderate disease activity. So these participants really did have moderate disease activity at the start of this study. When we looked at the score over time, we found that at 8 weeks already, so halfway through this 16-week intervention, the score was significantly lower as compared to the start of the intervention, but also as compared to this control group. So we found a drop in this disease activity of about 0.9, almost 1 point of this disease activity score. And that continued up to that 4-month period. So at the end of the 4 month, we found a statistically significant, but also clinically relevant improvement in this disease activity as compared to the standard care control group. And to put that in perspective, when we look at the effect of good anti-rheumatic medications, this change in this disease activity score is very similar also to the change that we found. And all the medications that participants were using, because people were on their standard medications, we also instructed them not to change change them throughout the study. So that's the rheumatoid arthritis group. Now, when we look at the osteoarthritis group, we use the WOMAC score. And the WOMAC score is an indication of pain, stiffness, and physical function. And this is a standard questionnaire that we use in all of research for osteoarthritis to indicate the severity of the osteoarthritis in these people. And at the start, they were at a score indicating quite a moderate to severe form of osteoarthritis. And throughout this 4-month period, we also found that this score decreased significantly, showing both statistically and clinically relevant improvement as compared to the control group. And yeah, that's quite remarkable, especially in this osteoarthritis group, because we really do have limited treatment options. On the one hand, we have the pain medication, we have the physical therapy, and really the end of the spectrum is the joint replacement surgeries. So it was quite remarkable to see that people could make a change themselves that was quite really impactful.
Coming back to something you said earlier, you were talking about the fact that I think we know as general practitioners that there's this increased risk of cardiovascular disease in people who've got rheumatoid arthritis. But you mentioned that increase in risk was also with osteoarthritis, and I didn't know that before. So it'd be interesting to know a bit more about what happened with the outcomes, the sort of things that we normally measure as part of cardiovascular disease. What did you find there came from the trial?
We measured so much in these people. These poor people had to undergo all these tests. Not only did we collect blood, but we collected saliva and also feces for our microbiome studies. But luckily, we have all this beautiful data, so we were also able to look at the various metabolic outcomes. When we begin with, for example, weight loss, we found that all participants as a whole had about 5.5 kilos of weight loss after these 4 months. And this weight loss was greater in our osteoarthritis group. They had an average BMI of about 33. And there we found a very large amount of weight loss, which was also significant compared to the control group where the weight was quite stable. So that was the weight loss component. But of course, when we look at weight loss, you can lose water and also muscle mass. So we also did DEXA scans. And there we also found that this weight loss was predominantly fat loss. So there was some loss in muscle mass as well, but the majority of it was fat loss. And what's quite remarkable about this, and one of our professors that worked with us, he studies muscle mass. And he also said, wow, in a study where you didn't emphasize or didn't do that much extensive strength exercises with these participants, it's quite remarkable that you actually didn't see that much muscle mass loss. So that could be potentially attributed to this anti-inflammatory component of the diet, for example. We also did MRIs, especially in our osteoarthritis group. Actually, only in our osteoarthritis group did we do MRIs. And there we were mainly looking at the liver fat. And we know that the liver fat plays a role in inflammation, but it also plays a role, for example, in glucose regulation or this insulin resistance, which is also a part of metabolic syndrome. And there we also found that this liver fat was significantly reduced as compared to the control group. And just to give a bit of context, if you have a liver fat percentage of 5%, we classify that as non-alcoholic fatty liver disease. These people started at 7% and dropped down to 2% after this 4-month period. So that was really incredible to see. It really had so much holistic effects on this body. So that was the liver fat. In both groups, we found that after the 4 months improvements in the waist circumference, which is really important for us because that's really indicates this visceral adipose tissue. It seems to be more pro-inflammatory. So that's more the body composition portion of it. When we look at the blood markers, we found improvements in HbA1c, which is the marker of glucose over a period of 3 months. We found significant improvements in the fasting blood glucose, LDL cholesterol in both groups. So really all those cardiometabolic factors, which we had expected to see based on earlier studies, we had also found back in our participants as well.
Wow, those are incredible changes. And so coming back to the adherence, you saw the kind of, you saw then borne out at a year that people were really sticking to these changes then?
Yeah, so when we look at the food component of it, we were mainly focused on the fiber and the saturated fat intake. So we would assume when people are adhering to a whole food plant-based diet that this fiber intake kind of skyrockets because they're getting hopefully a lot of whole foods fibers. And we expect a lot lower intake of saturated fats because we mainly see those saturated fats coming from animal products. So at the beginning, our participants had a fiber intake just enough for our dietary recommendations, which is about 14 grams per 1,000 kilocalories. And we found that this almost doubled in our participants. So they ended up eating about over 20 grams of fiber per 1,000 kilocalories per day. So that does indicate quite a good adherence to the whole food plant-based diet.
And was that something that you could tell from the stool samples as well?
That's a really good question. We're still analyzing them. So I actually received the data 2 weeks ago. So I have not been able to say anything about that yet. But because we do see such a big change in fiber intake, we do have our own hypothesis that this would also result in some changes in the microbiome. But unfortunately, we can't say much about that right now.
We always ask about that. We do know that the studies that are going on about the microbiome, a lot of them are more in the sort of hypothesis stage, but we always like to ask a cheeky question about the microbiome because people are so interested in it.
Absolutely. And that's one of our main hypotheses as well. How do we, what is the underlying mechanism behind the results that we find? And we know that this high fiber diet increases these great bacteria that produce these short chain fatty acids, that this could potentially be that anti-inflammatory or an anti-inflammatory factor that's contributing to the effects that we found. So that's also something we're, potentially expecting to see. Whether we find it, I don't know, but it does potentially play a role in our findings. Yeah.
That's just a remarkable amount of data that you collected and evidence. And I feel as a clinician I feel more confident to talk to people about their lifestyle now when it comes to their joints and their arthritis. But when I was doing some research for this particular episode, I kept coming across the conventional advice, being Mediterranean diet. And to me, I think a Mediterranean diet is largely plant-based anyway, perhaps with the inclusion of a small amount of fish or dairy. But the dairy component interests me because anecdotally in practice, I've always seen people feel better when they eliminate dairy if they have any sort of inflammatory condition. And I just wonder, is that actually brought out in the evidence? Is there any research on that? Or is that just something I've noticed over the years? Is there any basis to it?
Well, dairy specifically, can be quite difficult to tease out certain food groups. But for example, when we do look at the Mediterranean diet as a whole, it's kind of difficult because while it can be a very plant-based diet, how people interpret it can be quite difficult. So when we look at the research part of it, it can be hard to compare studies. As a whole, we do have some studies that show that a Mediterranean diet can have really good effects in people with rheumatoid arthritis. And one can postulate that has to do with this high fiber, this whole plant food component. So for example, when we look at our own data 1 year after the program, we conducted this adherence score. So we calculated this adherence score, which looked at the dietary components, so the fiber and the saturated fat intake, as well as the minutes per week of exercise and stress relieving activities. And what we did is we created 3 groups for both the rheumatoid arthritis and the osteoarthritis groups, of those, in the lower adherence, the middle adherence, and the higher adherence groups. So these 3 tertiles. And what we found is, first of all, in each of those 3 tertiles, there was significant effects. So when we look at the rheumatoid arthritis group, those that were the least adherent still had a significant improvement of their disease activity. But stepwise, as we looked at the middle as well as the higher group, as more adherent as you were to the program, the greater effect that we found. So this disease activity change was a lot greater in those adhering to the program more. And the similar trend we found in the osteoarthritis group. First of all, this gave us the indication, well, if you want to get the maximum effect out of a program like this, we really would encourage you to follow it as well as you possibly can, but you don't have to do it perfectly. And I think that comes back to this Mediterranean diet. It's not a perfect whole food plant-based diet, but it might just be enough for you, first of all, to notice effects. And if that is something that some people might be able to follow for a longer period of their life, to not be this strict, because being this strict can also sometimes create stress, which we see as a negative part of that as well. It might be better for you to maybe take a step back, and you really don't have to do it perfectly.
Wherever you are on that journey, a little bit's better than nothing, isn't it, with changes? And what about patients? I mean, they often talk to me about Mediterranean diet and fish. Is there anything in particular that you can tell us about fish and whether there's any evidence to suggest for or against?
When we look at the omega-3 fatty acids, which are those great fatty acids which are in fish, but also in algae, we do know, for example, in rheumatoid arthritis, there are some studies indicating supplementation with these omega-3s can have some benefit. There isn't enough evidence, but that could be a reason to say, hey, eating fatty fish once a week maximum could be fine, especially in people that are older. So those people above the age of 60 that do have higher protein needs, that could be an okay option. My personal preference would be to supplement with omega-3 from algae oil. That's the source that fish use as well. And the problem we see with fish is this bioaccumulation of various toxins, heavy metals in these fish. And there isn't enough evidence, but we do see that this could have some potential harmful effects on people. That is why also we advise for people that if you want to take omega-3 fatty acids, which is a very healthy choice, try to get it from the algae oil. And if that's not an option for you, then once a week fatty fish at maximum.
And what about certain foods that some people find like particular culprits of their inflammation? Often the nightshade group of foods come up. Is there any evidence for that?
There really isn't. We have a lot of people asking this question. They're very scared of it. We don't have enough evidence for that. I know there's a study that Neil Bernard performed in the United States looking at whole food plant-based diet as well in rheumatoid arthritis. And he had this whole scheme of eliminating certain foods and reintegrating them. And they actually found really nice effects on the disease activity in these people. But there currently isn't enough evidence for eliminating certain types of vegetables, for example. So we encourage people to just use them. One thing that we do see is that, for example, if someone's eating a whole food plant-based diet for a longer period of time and they're not noticing the effects that they wish to notice, or they still have a lot of complaints, one thing you could try is eliminating gluten. There is some potential evidence that shows that this could have effects. Again, not enough, but some people do experience benefits from that. But I'm always quite hesitant about a gluten-free diet if it's not absolutely necessary, because you do eliminate a lot of those really good sources of fiber, which we know is really important for the microbiome. So it could be something to try, but my advice is always really start with the basis, and only if that's, already going really well, is this something you could try, but it's not my first preference.
Where we, particularly as GPs, where we're trying to recommend things for people, the problem is always keeping it up. So it'd be interesting to know how your study was doing at a year.
So we did the measurements at 6 months as well as a year after the program and even a year after that. What we found is that these improvements, for example, in the disease activity in those with rheumatoid arthritis, they were maintained up till 1 year after the program and even 2 years after the program. The thing I find most interesting about these findings, so for example, in the first 4 months, the medication was kept stable. So all participants that were on medication were encouraged not to make changes. When in the extension study, so the year and 2 years after the program, participants were able to make medication changes when needed. And actually people that had a low disease activity, so this DUS score under 2.6, which is when we classify them as in remission, they were actually encouraged to taper off their medication. So we gave them a layout, a template for them to discuss with their own rheumatologists. And what we found is that 50% of people were able to reduce their anti-rheumatic medications of those using it 1 year after the program, with an average dosage reduction of 62%. And this is quite remarkable, first of all, because they did that in combination with keeping that disease activity low, but also these medications, they're not only very expensive, but they also have a lot of side effects. So they're quite heavy medications that impact the function of your immune system. This was a really important finding for us as well, because we were also potentially able to reduce those side effects of these people. When we look at the osteoarthritis group, we also found that the pain, stiffness, and physical function also remained low, and also significantly lower 1 and 2 years after the program as compared to the start. We also mentioned those metabolic effects earlier, but we also found that they were maintained not to the scale we found after the 4 months. We did find a significant improvement in the waist circumference of those with osteoarthritis. We didn't see that back in the rheumatoid arthritis group 1 and 2 years after the program. Also quite logical, because those with rheumatoid arthritis actually also already had quite a healthy weight. So it's only actually quite good that they stayed at that weight. But those with osteoarthritis, we were able to find that. And that was also accompanied with improvements in various metabolic markers. I was recently at the EULAR, which is the biggest rheumatology conference, and I gave this talk of the 2-year results in a session about osteoarthritis. And I gave my talk showing this change and that it was maintained for 2 years. And after me, all these professors were showing their new trials showing that an injection in the knee also resulted resulted in this improvement of this WOMAC score. But of course, over time, the score crept up again, so they needed another injection. And I was just thinking to myself, oh, how cool is it that you have something that, of course, you have to maintain it over the long term, but that this actually has effects that are maintained over the long term. So I think that's quite remarkable.
Absolutely. I think we'd agree if they can incorporate lifestyle changes that have those effects. Well, wow, that's incredible.
Thinking about your peers, other doctors, other researchers, other rheumatologists, how have they taken the work that you've done? Are they getting excited about lifestyle changes and plant-based diets?
They weren't at the beginning. Luckily, I wasn't there right at the beginning of the study, but I remember that Wendy told me she was presenting this study in our hospital, and it created an outrage that we were going to be studying something like that. And that's in the Netherlands, we call it kwakzalverij. I don't even know if there's a good English word for it, but it's
quackery, maybe.
Maybe, yeah, but it's, that there's really no fundamental basis for doing something like this. So there was a lot of resistance. Fortunately, we were able to get funding. Also, our own hospital supported us. Yeah, and we just kept working at it. So I think I really praise Dirk-Jan and Wendy for just keep going through that resistance. And now that we have these results, especially in the beginning, a lot of the rheumatologists were really surprised. And you can see a big switch in our hospital, but as well as the other rheumatologists in the Netherlands. So we're speaking at almost every international, but also national rheumatology conference. There is a lot of interest, especially because a lot of patients themselves come to their doctors asking for advice. What can I do myself? And a lot of times these rheumatologists don't really have answers to that. And now they are able to refer to us and they are able to give some advice as well. Again, it's not everyone. So in our own hospital, I recently got called by a nurse. One of the patients, he was already eating plant-based and he had a couple questions. So she came to me because his own doctor essentially was telling him that it was a waste of his time. Even then, it's really unfortunate.
Yeah. I mean, one of the things that struck me when I was at medical school and there was a talk from a rheumatologist and somebody asked the question, well, what do you do when people are just getting worse and worse with a rheumatoid disease and you're not making any improvement, they're not responding to the drugs? And the rheumatologist sat there and she said, it doesn't matter, what is going on for them. I feel that I can offer them hope or keep them on a path of hope. And we sort of sat there and we thought, oh, what a wonderful consultant. But hearing about this and thinking, how much more empowering would it be to actually say to them, look, you are in control of part of this. You can make a difference. I think it's incredible. I think it would make such a difference if we had this more as part of standard care. So that was what we were interested in is there any funding to implement this on a wider scale? What's happening there?
Me and my colleague Wendy, we actually started a limited liability company, which is called Plants for Health. With our primary goal is to implement this, first of all, in the Netherlands, and then we hope to also expand internationally. We want to make this available for anyone that wants to be empowered and wants to also make a difference in their own health and potentially also help their disease. So we don't actually have funding. We're doing a lot of it just ourselves on the side. Over time, we will be getting funding, hopefully. But right now, we're in the begin stages of, first of all, we evaluated our program. So we did focus groups and interviews. With that information, we have improved our program. So we have taken those essential components of our program, as well as some feedback points, and created this improved program, which we've also made more scalable. So we hope thereby to be able to reach a lot more people. Our goal is to get this program into the Dutch healthcare system. So we want to have this covered by our healthcare system. And I think it's quite unique, but in the Netherlands, we actually have this program called the Combined Lifestyle Program. Yeah, we call it the GLI, the Gecombineerde Leefstijlinterventie. Essentially, it's a guideline for lifestyle programs. So if your lifestyle program is 2 years long, if it has a multidisciplinary components, if there is enough evidence for it, it can be covered by health insurance. And so currently we're working with our government to try to get that accreditation to also be able to offer Plants for Health. First of all, for participants with rheumatoid arthritis and osteoarthritis. But it also kind of says it in the name. We've changed it from Plants for Joints to Plants for Health. We see all these benefits, and there is so much evidence of a program like this on the whole body. So not only the joints, but also the cardiometabolic portion of it. So that's also why we're trying to expand it to other chronic diseases, like, for example, cardiovascular disease.
I'm sure people who are listening who are living with arthritis have been flooded with information, and some of them are obviously, depending on where they are, they might be a way off having this more formally incorporated in their care. So would it be possible for you to give us the 2 or 3 take-home points for anybody listening to actually sort of really focus on and think, okay, how can I take this into my lifestyle myself?
Well, our first recommendation is look at the national dietary guidelines. That's a great start. So a lot of people already are just not complying with that. If you want to take it a step further, aim for as much as a whole food plant-based diet as you can. So really fruits, vegetables, whole grains, legumes, nuts and seeds in their whole form. That's a really good basis, obviously supplemented with the necessary supplements, vitamin B12 and D, and also omega-3s. When we look at the exercise component, we would encourage people to do 150 minutes of moderate intensive exercise per week, as well as 2 times a week of muscle strengthening exercises. This is what the WHO recommends, and it's a really good basis, especially also for people with rheumatoid arthritis and osteoarthritis. It's okay to move with pain, especially people with osteoarthritis can be quite scared, but we really need that movement in order to keep ourselves limber and reduce that stiffness. If someone's disease activity is very high, for example, in rheumatoid arthritis, take it easy, of course, listen to your body, but try to stay active in a way that works for you and you actually enjoy. When it comes to stress, we can't all live a stress-free life. There's a lot of external stressors, but we can change the way that we handle this stress. So it can help, for example, to look at what is in my power. Is there a possibility that I can take more breaks throughout the day, take some nice walks, find a way for yourself to be able to reduce that stress, because it does play a very important role. And I think for me, this was one of the bigger lessons I learned, the impact that stress can actually have on these chronic diseases like rheumatoid arthritis. You really see that a lot of these external stressors can actually create these people to have increased disease activity. So it is really important to tackle that. So I think those would be definitely my take-home message. But again, and maybe that's even the most important, you don't have to do it perfectly. Every step counts, and every step will lead to some improvement into your health. Do you want to get the maximum out of it? Then go for it.
That's brilliant. Brilliant advice. Thank you, Carlijn. And, backed by research as well. So there you go. We can't get any better than that.
I think one of the things we were reflecting on before we spoke to you was just how amazing to do a randomized control trial looking at eating and, as well as other lifestyle habits. Our listeners may not all appreciate this, but it is one of the most difficult things to do, to get people to do a trial where you're giving them sort of unpoliced behavior change. So incredible results there. But thinking about not policing your kitchen, Carlijn, we wouldn't do that, but we do need to know what you're having for dinner tonight.
I think I'll be having my favorite broccoli noodle salad. And this salad comes from the column from The Guardian, Mira Soda. She has her new vegan column. She's amazing. Her cookbook East is one of my favorites, but this recipe comes from the column. I add tofu, but essentially it's whole grain noodles in this beautiful sauce made of soy sauce, sesame oil, and spring onions. It has so much flavor and a lot of veggies. It's perfect. We eat it once a week. So that's what I'll be enjoying.
Oh, that sounds lovely.
It's very nice. You like a Mira Soda recipe, don't you, Claire? You often use her recipes.
Yeah, I rely on it because I think because she is in The Guardian, then she does have the unfair advantage that you do. Her recipes literally pop up a lot, don't they? And then you think, oh, I was thinking about what to have for dinner, and then there it is. And she does as we joke at home, she does like a lot of tamarind sauce, and so I've always got that in the fridge now. Where it was a little known ingredient to me before, but if you're going to cook anything by Mira Soda, indeed the thing you're doing tonight, Carlijn, it might have that as well. Yeah.
This one doesn't, but in her cookbook East, she has this peanut pad thai, which also has tamarind, and I make that when it's my birthday. Like that is the best thing ever. It is so good. So yeah, it's amazing. And actually, which came this week, her new cookbook dinner.
For people who are listening rather than watching, Carlijn's just showed us the new Mira Soda book. It looks beautiful. All the forks. No knives.
Yeah, and it's called Dinner, so it's all about dinner. Yeah, so I'm excited to continue to cook in that one.
Great.
Oh, lovely.
And what about you, Daisy? What are you having tonight?
Do you know, I need to get some more cookbooks because I seem to find recipes on Instagram and I just go for those. A smoky black bean, not really chili, but with the brown rice and whatever vegetables on the side. But it's really easy to make the black beans because I just buy a can of black beans, just drain them and wash them, and then chop up garlic and onion, red onion preferably, and a bit of chili oil, and then add your spices. So this has got miso, it's got a bit of paprika, and then you add your black beans, a bit of stock, and then just let it simmer for a few minutes, and it forms this really delicious miso, black bean, smoky. Yeah, I'd say chili. I guess that's the most appropriate word for it, but it takes sort of 10 minutes because obviously everything's already cooked. And then there'll be brown rice because I'm now a convert, Claire.
Oh, great.
Away from white rice.
From your tradition.
This goes well with brown rice, actually, this one. And then some coriander or whatever on top and whatever veggies you like. So I'll probably have some broccoli and sweet corn. So yeah, looking forward to that. It's quick and easy for a Friday.
And are you going to make any sort of, condiments to go with that? Do you ever use any of the, the kind of naughtier creme fraiche alternatives, or do you make a guacamole?
That's a good idea. See, Claire's really fancy with her recipes. I'm just like, bang a black beans on rice and you're done. Okay, I might try that, a condiment. I was just going to put chili sauce on it, to be fair. But, Okay. I'll think of a condiment. How about you?
Right. So I've got a book recommendation as well, which is I picked up from the Viva charity. They have got a really good, it's like a starter vegan book, but I bought it. I bought 2 copies of it and I thought, you know what, I'm going to promote the vegan diet here. I'm going to give one away. Maybe I'll hang on to one. Maybe I'll give it away. I've already given both the books away. And it's called Anyone Can Cook Vegan. And I think it was just £12. And the recipe that I'm going to be making tonight is a little bit of a faff, but it's really, really good. It's a recipe that I used to really enjoy when I was vegetarian, which is a ricotta cannelloni. But of course, no surprises. The ricotta is made by using dried yeast flakes, firm tofu. I think there's some lemon juice in there and some other seasoning. I might be missing something out here, but you make this sort of ricotta filling and then you fill your pasta cannelloni things. Of course, what goes with the ricotta, isn't it, is the spinach. So it's got chopped spinach and nutmeg in there as well. And that's the filling. And then you do quite a simple tomato sauce, which then sits over everything. And if you want to, you can, use some pre-bought plant-based cheese, or you can do some of the healthier options, which might be soaking some cashews and doing a blended cashew creamy sauce or something like that on top. But I'm doing that because we've got 2 birthdays in the house tonight. So I need to go to a bit of effort.
Oh, that sounds lovely.
That sounds amazing.
Yeah,
it's really, really nice. And it doesn't take as long as you think. I think the thing that takes longer is finding those cannelloni pasta things in the supermarket. I always feel a bit guilty when I make something like that, which is I'm not buying the whole wheat version because I haven't identified it.
But it's a birthday. It's a birthday dinner.
It is.
Have some white pasta from time to time.
And there's no dairy. It's fantastic. Yeah.
Brilliant. I'll enjoy. And so thank you so much once again, Carlijn, for coming on the podcast. We've really enjoyed speaking with you, and we really hope that the listeners will find this episode. I'm sure they will find it super interesting. We'll link all your studies in the show notes as well. But if somebody wants to reach out, how can they find you or chat with you?
Yeah, well, I'm on Instagram. I don't post much, but if you want to know more about Plants for Health, we have a Dutch but also an English website. So that's plantsforhealth. And there also we have a wait list. So people that are interested in this program, obviously it might take a bit for the international program, but those who have interest can sign up, leave some details behind, and then they can also receive a free recipe book. You can also read a lot about our study as well.
Oh, wonderful. We'll definitely put that in the show notes then. That's great. Thank you again. Thank you so much.
Thank you, Carlijn.
Thank you so much for having me.
Thank you for listening to the podcast. We aim to bring you the most up-to-date evidence-based information about the benefits of a plant-based diet, and we'll add all the links for further reading in the show notes. Please remember that everything discussed on here does not constitute individual medical advice, so please consult your healthcare provider if you have any medical concerns.
In the meantime, please subscribe to the In a Nutshell podcast on your usual streaming service and download our future podcast for free. And since food can be the best medicine, don't forget to share us with all your colleagues, friends and family. Until next time.